I'm pulling in some information regarding the nutrition across the lifespan. If this is something that you feel you're fairly confident in, then you don't have to listen to this presentation. I got this information from your Nutrition ATI Content Mastery Series book, and it goes through the different, kind of the little things in regards that you need to really think about as a nurse in regards to nutrition across the lifespan. Pregnancy and lactation, I'm going to talk about it first, and then I'm going to move on to the different developmental stages. Nutritional demands, there needs to be, when someone's pregnant, they need to increase their calorie intake by about 340 calories in the second trimester, 452 in the third trimester. And then as when they are pregnant, how much weight they gain varies depending on what their BMI was and their weight was prior to pregnancy. The doctors will make recommendations. Lactating women are required to also increase their calorie intake by 330 calories in the first 6 months, and then increase to 400 in the second 6 months if they continue to breastfeed. Nutrient requirements for pregnant women: 20% total calorie intake of protein, 30% of fat, and 50% of total calorie intake of carbohydrates. And what this increase of carbohydrates is to allow for protein to be spared so that it can help enhance fetal development. So we're using the carbohydrate. The women are using the carbohydrates for their energy. Vitamins and minerals, they want those to be increased for blood formation and absorption of iron and development of fetal tissue. Fluid needs to be increased. They need to increase their oral intake to 2,000 to 3,000 a day, take more folic acid of 600 micrograms, and increase iron by 50%. They need to avoid alcohol, caffeine, and fish as well. Infancy, when babies are born, you may have heard this before in developmental psych, but this is important in regards to looking at if they're nutritionally sound and they're developing properly, especially if pediatrics is where you're going to go into as a nurse. Their birth weight doubles in 4 to 6 months and triples in 4 years. Their appropriate weight gain is 5 to 7 ounces per week during the first 5 to 6 months, and then you're going to grow an inch per month during the first 6 months. Their head circumference should increase by 1.5 centimeters per month. Breastfeeding. You'll look in your book, in a lot of places they'll still say that breastfeeding is better than formula feeding. They've shown that there's a reduced incidence of chronic illness, type 1, which I mean by this is things like type 1 and type 2 diabetes, obesity, leukemia. Carbohydrates also and other nutrients such as iron, zinc, and magnesium are pre-digested, which makes it easier for the baby to absorb. And then also mother-infant bonding is promoted. Formula is a good alternative for breast milk. They do not allow or recommend milk products for at least a year because the child cannot absorb them. And if you're doing or using formula, it needs to be iron fortified, and this is recommended for at least 6 months. Going into the childhood and looking at childhood, which is going to break down further into toddlers, school-age children, and adolescents, there are some significant differences. Growth rate slows up until the time that they hit puberty, and then they will hit another very fast growth spurt, kind of like they did when they were infants. Energy needs and appetite vary as children age, and then attitudes towards food are established prior to the age of 5. This is why nutrition and how people eat and how parents and family members eat in front of their children really does influence their children and the habits that they obtain. Be aware of choking hazards with children because they have small airways. Things like hot dogs, popcorn, grapes, etc. They can very easily choke on those things. And this is where group eating becomes very important for children from the standpoint of socialization. Toddlers 1 to 3 years of old, the nutrition guidelines, they're going to grow 2 to 3 inches and up to 5 pounds a year. And again, this happens up until the age where they hit adolescence, and then they're going to have a growth spurt. We need to limit the juice consumption to 100% to 4 to 6 ounces a day. Food servings and how you manage or figure out what the serving size is for a child is 1 tablespoon for each year of age. And typically kids this age, it's better to just have plain finger foods around where they can come by quickly and grab things when they're hungry. Sometimes it's difficult to get them to sit down at a meal. We need to avoid snacks with high amounts of sugar. fat and sodium, and then again I talked about choking being a risk factor. Nutritional concerns and risk at this age. One of the concerns we have is for iron deficiency anemia, because they do need to eat sufficient amounts of lean red meat. But what happens and why they get iron deficiency anemia is because sometimes they take too much milk in. We need to limit the amount of milk because it's a poor source of iron and it reduces the absorption and intake of iron-rich foods. A friend of mine's daughter ended up anemic because of having or drinking too much milk when she was younger. Children at this age require more vitamin D. They can get this from sunlight, and then they need the vitamin D to help to absorb the calcium. Preschoolers age 3 to 6, nutrition guidelines, again, grow 2 to 3 inches and 5 pounds per year. They need 13 to 19 grams per day of complete protein, and also including calcium, iron, folate, vitamins A and C. They may like raw vegetables that are finger foods. They don't like real vegetables that smell or have a powerful odor. Again, we talked about having foods that they can handle in their fingers. Food jags are common, which is where they have a preference for one type of food. Maybe they just want yogurt. Maybe they just want cheese. Okay, that is normal for this age group. Friends begin influencing their preferences and habits around the age of 5. Nutritional concerns and risks. A lot of times we worry at this age about overfeeding and intake of high-calorie fat, sodium, soft drinks, juices, things like that. Tablespoon servings size we talked about previously, 1 tablespoon per age. We need to try to avoid fat and high-sugar foods. Encourage daily physical activity, and at this point they can start drinking skim or 1% milk after the age of 2. School-age children, 6 to 12 years of age, they're going to grow. Again, this is similar, 2 to 3 inches, gain 5 pounds a year. They may start getting into sports, which is going to mean that they need more energy. They need more energy, and they get this with protein, and they may have increased fluid needs as well to prevent dehydration. We need to educate children to make healthy food choices, enjoy learning how to safely prepare nutritious snacks. In other words, these kids really do enjoy learning how to prepare these snacks. And we need to make sure that we encourage them to only eat when they're hungry, not bored. That's supposed to say bored, or inactive. Nutritional concerns of this age group is that they often skip breakfast, and what they found is that optimum performance is dependent on them eating a nutritious breakfast. And regular breakfast is important, and they've shown that people end up with the appropriate BMI if they actually do eat breakfast every day. The obesity rate is about 20% of children are obese. There is a psychological implication for obesity. They get bullied. They feel bad about themselves. So the biggest thing here is prevention is the key. We need to praise child's ability and skills and never use food for a reward. Adolescents, growth habits, quick rate of growth. They need energy, protein, calcium, iron, and zinc during puberty. Females usually will hit puberty between the ages of 10 and 11 and peak at age 12. They're usually complete with puberty or done with puberty by 17. Males, ages 12 to 13, peak at 14 and complete by 21. Often their adolescents, their eating habits are inadequate, okay, because they go off and they eat in vending machines, and sometimes I know I have a 14-year-old who tells me he's not hungry. So, energy requirements, that females require 2,000 calories a day. Boys require 2,200 to 2,800 calories a day. And if you look here, it said the average U.S. adolescent is deficient in folate, vitamin A and E, zinc, magnesium, calcium, and fiber. And a lot of times their diets actually exceed the recommendations in fats, cholesterol, sodium, and sugar. They're not eating very well. Nutritional risk for this age group is they tend to skip meals. Food is selected from vending machines and convenience stores. They tend to replace milk and fruit juices with carbonated beverages. Iron needs to be increased in females due to support the blood loss during menstruation. They need 15 milligrams a day. Males need 11 milligrams a day to support expansion of muscle mass and blood volume. Teenagers, adolescents at this age usually have inadequate calcium intake. Diet is usually unhealthy, eating habits and use of high-protein drinks, and they a lot of times often have eating disorders. Eating disorders such as anorexia nervosa, bulimia, and binge eating. And then also there's risk factors with adolescent pregnancy, and a lot of times girls that are pregnant when they're adolescents, it's hard enough for them to maintain nutrition for themselves, but they have to now maintain it for their baby as well. Adult and older adulthood, balanced diet. We need 40 to 55% carbohydrates and 10 to 20% fat, and the rest protein. Older adults need to reduce the total caloric intake because we have decreased, meaning me, I'm getting there, maybe not quite. We have a decreased basal metabolic rate. Our metabolism doesn't work near as fast, so it's harder for us to burn off calories. So a lot of times we have to reduce the calories, which may also still lead to nutrient deficiencies, so we have to be careful that we're balancing our diet effectively. And then physical, mental, and social changes kind of affect the ability to purchase, prepare, and digest food and nutrients. And then a lot of times as we get older, dehydration can also occur due to lots of variations in our ability to drink fluid. The medications and things that we're taking can alter our fluid intake as well. Thank you and have a good day.